Okay, here we go. Hello, everybody, and I'd like to welcome you to the 2021 Canadian Global Oncology Workshop, brought to you by Queen's University this year. I'm Scott Barry. I'm a medical oncologist and chair of the Department of Oncology at Queen's, and it's really my pleasure to welcome you to this year's event. And on behalf of Queen's and the Queen's Global Oncology Program, thanks to the Canadian Global Oncology Network for the opportunity to host this year's event. I'd like to thank the members of our executive team here at the Queen's Global Oncology Program, Doctors Nazik Hamad, Fabio Moraes, and Chris Booth for their support. And a special thanks to our Global Oncology Program lead, Laura Carson, who has really worked above and beyond the call of duty, not only in bringing the meeting arrangements together, but she's actually been part of the team working on the session on universal healthcare and global cancer care. So Laura, thanks for all of your efforts. I think we're going to see the fruits of those efforts over the next couple of days. It's been an absolute pleasure working with the organizing committee, and Dr. Rodin will be talking a little bit more about our organizing committee soon. They really have put together an exceptional program, and for the next 2 days, we're going to see some incredible sessions. We're going to be able to learn a lot, and I'm really looking forward to seeing these sessions. The team has put a lot of work into these sessions. They're going to be informative, engaging, and we have some incredible speakers coming over the next couple of days. I'd like to let you know that the Canadian Global Oncology Workshop is a flagship event for the Canadian Global Oncology Network. And it's really my pleasure to introduce Dr. Danielle Rodin, who's the chair of the Canadian Global Oncology Network. It's really her vision and leadership who brought the network together. Dr. Rodin was the chair of the first workshop at Princess Margaret Cancer Centre hosted last year. And I'd like to welcome Danielle to tell us more about the Canadian Global Oncology Network. Just a brief introduction, Dr. Rodin is a radiation oncologist at Princess Margaret Cancer Centre and assistant professor in the Department of Radiation Oncology at the University of Toronto. She's director of the Global Cancer Program at Princess Margaret and director of Equity, Diversity, and Professionalism at the University of Toronto Department of Radiation Oncology. She's also an elected member of the board of directors for the Union for International Cancer Control in Geneva. Welcome, Danielle.
Thank you so much, Scott. And hello, everyone. Good evening. It's really a pleasure to be here this evening on behalf of the steering committee of the 2021 Canadian Global Oncology Workshop, which is being graciously hosted by the Queen's Global Oncology Program. It's really my pleasure to welcome you all this evening. This is the second workshop in what I'm now delighted to say has become an annual event as part of the new and emerging Canadian Global Cancer Network. Last year, the first Canadian Global Oncology Workshop was held as really a first step in an effort to understand the landscape of work in global cancer control across Canada and to identify opportunities for pan-Canadian collaboration. It was very clear at that workshop that there were many individuals and organizations that had committed to addressing disparities in cancer control here in Canada and internationally. But there was also a recognition that much more awareness and understanding of the scope and breadth of these activities across the country was needed. And from this shared understanding and the connections that developed at the 2020 workshop came the idea of a network, which is really a structure to connect individual global cancer initiatives led by Canadians. And these global health networks have been identified globally as a major determinant of how we understand global health problems, the inclusion and engagement of individuals to advance some core issues in the field, and the attention and resources that these problems received. And it's clear from the discussions last year that Canada has substantial depth of experience in global cancer control, in strengthening health systems, and in promoting health equity, and that we have a unique opportunity to collaborate with each other and with our international partners, and to really contribute on the world stage. The creation of the Canadian Global Cancer Network was identified as a potential platform to unify our community in Canada to become a more effective force in advocacy and health policy, research, and education and training, and one that could support a philosophy around global partnerships that address present and historic inequities in cancer control. And the decision to turn this workshop into an annual event is an important next step in the consolidation of our Canadian global cancer community and its approach. And its success will most certainly depend on the efforts of everyone here. The steering committee for this year's workshop is made up of a diverse group of people working in global cancer control across the country from coast to coast. These include our workshop hosts, Dr. Scott Barry, Dr. Nazak Hamad, Puneet Bains, and Fabio Marias from Queen's University, Drs. Craig Earle and Heather Bryant from the Canadian Partnership Against Cancer, myself and Dr. Mary Gospodarowicz, Meredith Giuliani, Brooke Wilson, and Anna Dare from Princess Margaret Cancer Center, Dr. Zeev Rossberger from McGill, Drs. Gina Ogilvie and Simon Sutcliffe from UBC, Dr. Richard Spence from Dalhousie, Rianne Booker from Calgary Palliative Care Services and the Canadian Association of Nurses in Oncology, and Dr. Sumit Gupta from the Hospital for Sick Children. And I would be remiss not to acknowledge all of the incredible work of Laura Carson, the program manager for the Queen's Global Oncology Program. The workshop this year could not have happened without everyone's commitment and dedication. The events planned for this evening and tomorrow will touch on issues that have captured global attention over the last year. We'll start tonight with a discussion on global health equity, followed by sessions tomorrow on racism and coloniality in global cancer control, universal health coverage and its relationship to global health security and cancer, cervical cancer elimination, and digital health in global oncology. And in these sessions, we'll have an opportunity to listen and engage with Canadian and international experts in these areas who will undoubtedly give us new perspectives and new ways of approaching these pressing problems. Reducing disparities and promoting health equity globally in cancer control is certainly a major theme of this meeting. But we also hope that the discussions will encourage reflexive work to address systems in our own organizations and institutions that may unintentionally reinforce some systems of inequality. In a moment, you'll hear from Scott Barry with the results of the pre-workshop survey. And this survey was circulated to all of our registered participants to update our landscape analysis of work that is being done in global oncology across the country, and to hear about how we can leverage our emerging network to support and advance Canadian efforts in global cancer control. I'm eager to explore the comments and feedback from the survey and to continue these conversations during the discussion and networking sessions over the course of the workshop. When we hosted this meeting last year, we were deep into the second wave of COVID and vaccines were not yet available across the country. And we're fortunate in Canada to have been able to roll out a widespread vaccination program, albeit not without its challenges. However, the enormous global vaccine inequality has continued to remind us about the need to remedy dramatic global disparities, and that the health of individuals and the strength of health systems in all parts of the world are inextricably linked, that really we're all in this together. And that working together with our global community to improve cancer care for all patients and their families is an essential part of our global responsibility and a profound statement of our shared humanity. So with that, I'd like to express my deep gratitude to everyone for being here this evening, as well as to the steering committee and our hosts at Queen's University, without whom the workshop this year would not be possible. I'm really looking forward to all of the great discussion to come. And I'll now hand it back over to Scott Barry.
Thanks so much, Danielle. Inspired words, and thanks again for your leadership and vision. I think that you have really brought this Canadian Global Oncology Network together. It's an incredible group, and certainly working with that group, the network members are really the steering committee has been one of the real pleasures of organizing this meeting, and really pan-Canadian. Engaged and really interested in improving global health equity. And you'll be meeting many of them in the sessions over the next couple of days. So thanks, Danielle, for your vision, and thanks for the opportunity to host this year's workshop again on behalf of the network. So as Danielle said, I'm going to lead you through highlights of the Canadian Global Oncology Workshop pre-workshop survey results, and The highlights are here, but the full results are in a booth in the networking sessions tab. So if you'd like to see the full results, and there's some really rich comments that I can't go into great detail about, please take some time. There's a booth dedicated to this, and you can see all the results and thoughts from the survey. So first of all, thank you. We had 49% response rate, which is really incredible. The years worked in oncology range from 1 to 50, and I was about mid-range there, so that was reassuring. And about 59% of people work in an academic setting. The primary practice location, you can see, given this is Canadian Global Oncology Workshop, most of our participants are from Canada, but we have people from all over the world joining us at this year's workshop. You can see that about 2/3 of our participants are practicing. 27% are trainees, which is great, because I think that our trainees are our future, and it's great to see that they're coming. And about 7% are retired. Most of our participants are physicians and oncologists, but you can see that we have, again, a really multidisciplinary group of attendees, and I think that adds to the richness of discussion and potential for collaboration at this year's workshop. Again, if you look at the main discipline, we have a wide variety of disciplines represented here. Public health is actually the most common, followed by oncology. Again, a very wide range, increasing the opportunities for collaboration, interdisciplinary discussion, and a great collaborative workshop. As we said, most people work in an academic setting, but we have people from multiple sectors and work settings here tonight. Looking at the focus of current cancer control efforts, most respondents were interested in cancer treatment, but also many people interested in early detection, diagnosis, and prognosis, cancer prevention, cancer control, and survivorship. So broad areas of interest. And you can see in terms of the main funding for sources, the main funding sources for global cancer control activities, most respondents, the most common response was no direct funding. And we'll get back to that a little bit later. Do you have protected time for your global cancer control efforts as part of your current position? Only 1/3 actually have protected time. Are you engaged with efforts to address cancer care inequity within Canada? And the majority of our participants aren't, but this will actually be the focus of our first session tonight, in terms of how we can work together to address both inequities and address disparities in Canada and in other settings. When we asked what challenges do you face in engaging global cancer control efforts in Canada, this is the word cloud that came out, and you can see that funding is the number one concern, far outweighs all of the other responses. And I think that's something we can discuss as the workshop goes on, in terms of opportunities to garner more funding and generate more resources to support our efforts. In terms of, we asked a question, what specific outcomes or outputs would you like to see from the Canadian Global Oncology Workshop? And I've highlighted in red here things that we are going to be able to achieve, I think, by the end of this workshop. We do have topic-specific network breakout rooms. We are going to have an annual meeting and many more things. And you can see that the things that are bolded in italics, lots of opportunities for collaboration and partnerships, connection. And one of the major pieces of feedback we had last year was that we should have more opportunities for networking. So in addition to our sessions, which are going to be very interesting, we have lots of opportunities to network later tonight and tomorrow during the midday break. So those are the highlights of the pre-survey, the pre-workshop survey. As I said, you can go and see the full results and in one of the workshop sessions. There are more comments and detailed results there.